Fat transfer was used many years ago, however the results weren't that predictable. But now we're using new techniques to be able to place fat into the facial anatomy and also into other body areas, and we're getting long-lasting results. The advantage of fat transfer over things like fillers is that it's long-lasting. It's also very natural, but the fat has stem cells in it as well. So when we inject the fat into whatever area of the face, you get this longevity, a change in the skin that makes you look glowing. So fat transfer, I believe, is one of the new techniques that we're going to be using more and more often. So in what areas can we use fat transfer? The temples, the forehead, the cheeks to give that youthful and elegant look. We can even use it to the chin and changing the face in the lower part of the face here. So the fat can be transferred to all parts of the face, and in some cases we'll inject 20 to 30 mils, depending on the anatomy and the issue. It's also very good for scars, elevating scars. We can inject it under the eyes, and we can also inject it into the upper eyelids for hollow eyes as well. So it's very versatile. We can do it under local anaesthetic, which is great. And then with larger areas of fat transfer, quite often I'll put the patient off to sleep, and we will also do some liposuction at the same time. So it very much depends on what the patient needs. So the way that fat transfer works is like this. We take some fat from one part of the body, and it can be your unfavourite part, be it on your belly or on your thigh or on your buttocks. And we usually harvest around about 10 to 20 mils of fat per area, so maybe 100 mils in total. We do this under local anaesthetic in the rooms, and then we place local anaesthetic on the face as well so that we can re-inject it. Once we actually have the fat, we spin it down in a centrifuge, and once it's spun down in the centrifuge and all the extra fluid is removed, then we can re-inject it. I'm actually using a new machine as well, which is fantastic, called the Eco. And the Eco allows us to take the fat, clean it all at once without having to use the centrifuge, and then re-inject it into the face. And that is my dream machine that I'm using more and more often. So the whole process is becoming easier, and it's more predictable. And there are other things that we can do to help the fat stay in its new position. So in terms of how long fat lasts, well, the fillers that we use in the face can last anywhere from 6 months to 12 months. And sometimes, if you're lucky, they may last 18 months. Whereas fat transfer, once we've injected the fat, it can last up to 3 years. And in fact, we can see a permanent result in some cases. There's no doubt with fat transfer that initially after it's injected, you do lose some of the fat, and so we may need to do a little top up 6 months afterwards. However, once that result is stabilised, then it can stay there for 3 years and even longer. The interesting thing is though, after 6 months, and even a little bit longer, closer to 12 months, we start to see some changes in the skin, where the skin becomes tighter, it becomes better quality, and I think this is the effect of the stem cells having an effect on the skin. So the benefit of fat transfer over fillers, a bigger volume can be used, and it's a longer lasting result that is certainly more natural.